immunization partners, representatives of NGOs, religious leaders, political leaders, officials of QRH, officials and directors of the Ministry of Health, IVD technical team, community health workers, oye! Members of the press, ladies and gentlemen, Jamhuri ya Muungano wa Tanzania. Oh, you didn't say it well. Maybe I didn't say it well myself. I will say it again. Jamhuri ya Muungano wa Tanzania. Thank you very much. Thank you very much. I'm indeed honored to represent the World Health Organization, the UN community, and all immunization partners in this very important occasion. I'd like to thank the Ministry of Health through the leadership of our dynamic Minister of Health, Minister Magama, for inviting me to participate in this launching of the Africa Vaccination Week for the year 2025. Honorable Minister, this year Tanzania is celebrating 50 years since the launching of immunization program to ensure that all children in the country benefit from the life-saving vaccines. This is a big achievement indeed, and we need to congratulate the country through its leadership, Dr. Samia Suluhu Hassan, and the sector Minister, Minister Janesta Magama. EPI has marked several milestones over the years, including eradication of smallpox in 1980, which stands as monumental achievement in the history of immunization, indeed in health. The expansion of childhood vaccine programs from 3 vaccines to over 10 vaccines, and the establishment of a robust vaccine supply chain were equally critical, allowing vaccines to reach even the most remote areas and endure extreme temperature conditions. The vaccine availability in the program now encompasses children's vaccine, adolescent vaccine, as well as adult vaccines. The African Vaccination Week commemoration illustrates the country's commitment to the attainment of longer and healthier lives as part of the achievement of the Sustainable Development Goals. I would like to take this opportunity to congratulate the government of Tanzania for the many initiatives taken to reduce the risk of vaccine-preventable diseases in the country. As we all know, immunization is one of the most cost-effective ways to ensure long and healthy lives. And every year, vaccines save between 2 to 3 million lives globally, and millions more are protected from disease and disabilities. Honorable Minister, the theme for this year, 2025, is to ensure that immunization successes of the past 50 years are built on in the coming decades. This year, the theme is immunization for all is humanly possible, which aims to continue the humanly possible campaign with a future looking forward on the importance of ensuring more people, especially children, are vaccinated. This annual event is aimed to raise awareness of the value of vaccines and immunization. Tanzania is urged to continue engaging communities to promote the importance of vaccination in bringing people together and providing the health and well-being of everyone, everywhere throughout life. Today's occasion will first and foremost increase trust and confidence in vaccine to maintain or increase vaccine acceptance. And secondly, increase investment in vaccines, including routine immunization and other primary healthcare interventions. Data shows still some children are missing the life-giving vaccines due to many reasons, including leaving them at risk of serious diseases like measles and polio. In this context, this year's campaign will aim to build solidarity and trust in vaccination as a public good that saves lives and protects health. Tanzania is among the countries which have made tremendous progress towards achieving global goals. The last case of polio was detected in this country in 1996. Therefore, this country and the African region have been declared polio-free. Tanzania has also eliminated neonatal tetanus in the year 2012 and is moving steadily towards achieving measles elimination. Shall we applaud the country for these milestones? Honorable Minister, WHO and all immunization partners are pleased to be part of the African Vaccination Week campaign, where those children who miss their dose of vaccine will be vaccinated and hence increase the herd immunity. The selection of Tabora region as a region for the national launching is also commendable due to the historic difficulties by the region to reach all targeted children for vaccines. The WHO was able to join hands with the region in addressing the gap by providing support to conduct catch-up vaccination, which targeted 3 districts, Kaliwa, Shikomji, and Uluwi, identified to have high numbers of zero dose. The campaign aimed to reach all villages, some of which do not even have roads, and some in very remote mountainous areas. At the end of the campaign, it was a very big success, and we hope that these efforts will be sustained. We would like at this juncture to commend the Regional Commissioner, the Regional Medical Officer of Health for such a laudable achievement. Shall we give them a hand? Honorable Minister, while we celebrate 50 years of expanded program of immunization, we need to continue with educating families so they understand and can demand better health services and ensure that all their children are vaccinated. To ensure immunization reaches every eligible person, there are health system challenges that need to be addressed. And this includes inadequate infrastructure, transportation, power supplies for refrigerators, limited number of frontline health workers, as well as stock out of vaccines and other essentials, like syringes. Partners are happy to know that efforts are in place to address these, and the government is making every effort to ensure that these challenges are addressed at all costs. Therefore, we once again want to commend the government of Dr. Samia Suluhu Hassan and the Minister of Health, Janesta Danu, for ensuring that these are put in place to make sure that no child or no person who needs vaccination is left behind. Honorable Minister, I would like to assure you that the WHO and the entire UN community stand committed, together with you and all vaccine partners, to support your efforts in committing both human and financial resources necessary to achieve and sustain the high vaccine coverage in children and adults. So this Africa Vaccination Week, let's ensure vaccination retains its place in the national development and security agenda. As the African Vaccination Week campaign is officially launched today, We would like to take this opportunity to encourage all parents and guardians of infants and young children to participate in the campaign. This campaign is already taking place in this place, and we need to make sure that it does not become a one-week wonder, but it's continued throughout the year and all the time. Before I end, I would like to once again thank all the key vaccination and the players, the vaccination partners like John Snow, like the Clinton Health Access Initiative, PASS, the PIGO, AMREF, the Lions Club, the Red Cross, Girl Effect, Village Rich, Rotary International, but particularly to thank the government, the Ministry of Health, Pure Rights. Want to thank all health workers. We also want to particularly appreciate the community health workers who are on the ground and are the backbone of the health service. Shall we give them an applause? And I would therefore like to say, Mungu ibariki Tanzania. I thank you.
Jambo la kwanza tumshukuru sana Mwenyezi Mungu ambaye ametufikisha salama, lakini jambo la pili tumshukuru sana Mheshimiwa Rais kwa kazi kubwa anayoifanya, lakini hasa katika eneo la afya. Sisi kama wakazi wa Tabora kwa kweli tunakutuma na tunakuagiza ukampe salamu nyingi sana kwamba watu wa Tabora wanaridhishwa sana na utendaji wa kazi, lakini hasa eneo la afya. Mheshimiwa Waziri, tumeshuhudia na tumeona kwa macho yetu kwamba tumepata hospitali nyingi za wilaya, lakini vituo vya afya pamoja na zahanati. Lakini kama hiyo haitoshi, tumepata vifungashio pamoja na dawa na vifaa tiba, na wauguzi na madaktari wameajiriwa. Kwa hiyo sisi kama watu wa Tabora, shukrani zetu kubwa ni kuhakikisha Mama Samia Suluhu Hassan mwaka huu 2025 mwezi wa 10 tunampa kura zote za mkoa wa Tabora kuhakikisha anarudi kuwa tena rais wa nchi yetu. Lakini nitumie nafasi hii kukupongeza wewe kwa kazi kubwa. Toka umeanza kupita wizara mbalimbali hujawahi kutuangusha Watanzania. Hongera sana. Lakini mkuu wetu wa mkoa anachapa kazi kubwa pamoja na wakuu wetu wa wilaya wakiongozwa na mkuu wa wilaya ya Tabora mjini ndugu yangu Katwale. Hongera sana. Lakini Mheshimiwa Waziri, takuwa mchoyo wa fadhila kama sikusema wasimamizi wakuu wanaosimamia wizara yako ya afya katika mkoa wetu wa Tabora, hasa Dr. Honorata pamoja na ma-DMO wote. Kwa kweli wanafanya kazi kubwa chini ya uongozi wa rasi wetu Mboya. Hongereni sana, kazi mnaifanya. Hatuwezi tukasubiri mkaondoka ndio tukawasifia. Sisi kama daraja kati ya wananchi na serikali tunaridhishwa na utendaji wenu wa kazi. Pamoja na Chama cha Mapinduzi, kwa niaba ya Mheshimiwa mwenyekiti wa mkoa, chama kinaridhishwa na kazi zinaofanywa na serikali ya awamu ya 6 chini ya Mama Samia na viongozi wote. Baada ya salamu hizo, Mheshimiwa Waziri, nitakuwa na jambo moja na lenyewe ni ufafanuzi, sio kulaumu. Na katika hili jambo daktari wa mkoa pamoja na rasi wetu wamekuwa kipaumbele sana kutusaidia au kututetea ili jambo likitokea. Kumekuwa na ukakasi kidogo kama ikitokea watu wameleta mgonjwa na kwa bahati mbaya yule mgonjwa akafariki na ile familia inakuwa na uwezo duni, wanakuwa muda mwingine wana madeni. Sasa inakuwa mpaka upite kwa katibu tawala, mpaka umpigie dokta mkuu, na mara nyingi tumesikia bungeni wakisema na waziri wa afya kwamba akifariki mtu, ikithibitishwa hana uwezo, ndugu wa marehemu wapewe mwili wao. Nilikuwa na kuomba tusikie kauli ya waziri, lakini tusikie kauli ya serikali. Baada ya kusema hivyo, nawashukuru sana. Kidumu Chama cha Mapinduzi!